Welcome to the Aetna Medicare Advantage informational presentation for health plan and prescription drug coverage offered by the Labor Benefits Association. This presentation is intended to introduce the medical and prescription drug plan options offered to the City of Chicago retirees for 2019 through the Labor Benefits Association. You will have the option of choosing the Aetna Medicare Advantage Premier or Standard medical and prescription drug plan. I'm here today to help familiarize you with the 2019 Medicare Advantage plan options available through the Labor Benefits Association. If you have any questions after listening to this presentation, simply call Aetna's dedicated customer service line at 1-800-307-4830. I will also provide this number again at the end of the presentation in case you weren't able to write it down now. So what's happening? You now have the option of enrolling in an Aetna medical and prescription drug plan. Aetna was chosen as the health plan because of our comprehensive benefits with cost savings for members. We offer extra support programs and achieve high overall satisfaction ratings from our members. The Aetna Medicare Advantage Plan includes comprehensive coverage, including 100% coverage for most preventive services, predictable copays for most medical care, prescription drug coverage that provides full coverage in the coverage gap, often referred to as the donut hole, benefits that complement your doctor's care and help you manage your total health, physical, emotional, and social. Sit back and listen, and we will give you all the necessary information for you to understand whether the Aetna plan will provide the coverage you need and want. Who is Aetna? We're one of the country's largest health insurers. We have over 165 years of experience in providing health benefits. We're devoted to helping our close to 1.5 million Medicare Advantage members manage and improve their health. We're also a highly rated plan based on quality that the Centers for Medicare and Medicaid Services, or CMS, measures. CMS is part of the U.S. Department of Health and Human Services and works to ensure all patients get the very best health care. Medicare Advantage plans are assigned a score or star rating, and Aetna's national plan received 4 out of 5 stars. This means our plan is highly rated on important measures such as member satisfaction and service, helping you stay healthy, helping you manage your long-term conditions. Our mission is dedicated to health. The Aetna plans are designed to build a healthier world, and we know this is especially important in retirement, and simplify the healthcare experience, as we want to help you reach your full potential. You should know that the plans offered through the Labor Benefits Association are highly customized group plans, just for the City of Chicago members. Not only has Aetna been around for a long time, 165 years, but we have been working with Medicare since the beginning as well. Back in 1966, Aetna paid the first ever Medicare claim. Our Medicare plans are something we take great pride in to this day, ever since that first check in 1966. We will cover the following topics in today's discussion. How will the Aetna Medicare Advantage plan work and how it may be different than your current plan? How you can continue to see your providers. What are your benefits? What's next? After the presentation today, we want you to feel comfortable with your health plan options and comfortable that Aetna will take care of you into the future. Introducing your health plan options. We think you'll find that the Aetna Medicare Advantage plans are simple and easy to use, and we'll show you how. As some of you may know, Medicare Advantage offers you the convenience of all of your Medicare Part A and B benefits, as well as Medicare Part D prescription drug coverage. This is everything you get with original Medicare coverage, plus many additional benefits. These additional benefits include the support of Aetna's care advocacy and wellness programs at no additional cost to you, all in one package. Medicare Advantage plans are easy to use, with only one ID card for all medical and pharmacy needs. You will also receive only one monthly explanation of benefits for your medical services and one for your prescription drugs. Medicare Advantage offers you coverage for all Medicare-approved services. To be eligible, you have to be enrolled in Medicare Parts A and B and pay your Part B premium. You can only be enrolled in one Medicare Advantage plan at a time. Again, we want things to be easy. The Medicare Advantage plan will have one ID card for all your medical and pharmacy needs. The plan includes more benefits than traditional supplemental plans. Included in the plan are care advocacy and wellness benefits that we will discuss shortly. Finally, as I mentioned, you will receive one monthly explanation of benefits, or EOB, for medical services and one for pharmacy services. These monthly EOBs include valuable information on where you are in meeting your deductible and out-of-pocket maximum. We understand having a plan with extra benefits is great, but you may ask yourself, will my doctor take this plan? Let's review the network details to answer this question. The Labor Benefits Association chose Aetna's Medicare Advantage Preferred Provider Organization with an Extended Service Area, or PPO-ESA plan. The Aetna PPO-ESA plan provides access to providers nationwide. This type of plan is different because, 1, your doctor does not have to be in our network, and 2, you enjoy the same benefits and cost sharing in or out of network. So even if you visit a provider who is not part of Aetna's Medicare Advantage network, you will still pay the same cost share as if the provider was part of Aetna's network. The only requirement is that the provider must be eligible to accept Medicare and agree to accept your Aetna plan. If your doctor is accepting your Medicare plan now, chances are they may accept the Aetna Medicare Advantage plan. Often, you will have Aetna Medicare network providers available to you. These providers go through an extensive credentialing process. This ensures that members receive the best possible care. Also, these providers are familiar with our Aetna medical management programs, and they can help you get the most out of your Aetna Medicare plan. You do not need a referral to visit a provider. You can go to any provider accepting the plan. Because Aetna Medicare Advantage provides coverage nationwide, when traveling away from home, we will help you find a doctor that accepts the Aetna Medicare Advantage plan. And keep in mind, the plan also covers you when you are traveling outside the country in case you have an urgent need for medical care. Aetna's Medicare Advantage plan is designed to give you the flexibility to see any provider whether or not they are in our network. Again, the provider simply needs to be eligible to accept Medicare and agree to accept your Aetna plan. As we mentioned, the key difference with your customized Aetna Medicare Advantage plan is that it doesn't cost you more if your provider isn't in our network. Your cost share amount, which may include copays and coinsurance, is the same, both in and out of network. You should know that many doctors do in fact accept Medicare and accept Aetna Medicare Advantage, but there may be some that don't. You have two primary ways to find out if your doctor is in the Aetna Medicare network or will agree to accept the Aetna Medicare Advantage PPO-ESA plan. First, you can call us at 1-800-307-4830 if you have questions about certain doctors or need help finding a new provider. Our representatives are available Monday through Friday, 8 a.m. to 6 p.m. in all time zones. Second, you can visit AetnaRetireePlans.com and click on the provider search, where we have an online provider directory. But don't worry if you don't see your doctors there. Our network is continually growing. You can give us a call at 1-800-307-4830 and we can help you find out if your providers accept our plan. Remember, the plans being offered to you through Aetna are Medicare Advantage PPO-ESA plans. So the same cost share will apply to providers in the Aetna network as well as providers who are not in the Aetna network. If you're interested in enrolling in an Aetna Medicare Advantage plan through the Labor Benefits Association, you can choose between two options. Let's review the medical benefits of each to see which one may be best for you. The Aetna Premier Plan. The Premier Plan has no deductible. This plan covers all of your medical services at 100%. You will not have any cost share for your Medicare-covered medical services. The price of this plan, which includes prescription drugs, is $327.13 per member per month. There is no out-of-pocket maximum because you will only be paying your monthly premium. The Aetna Standard Plan. The Standard Plan has a $250 deductible. This is the amount you will be responsible to pay before the plan will start paying. Once you have met your deductible, you will begin to pay your cost share amounts. These cost share amounts include primary care and specialist office visits have a $25 copay. Emergency room has a $50 copay, which is waived if you are admitted. Urgent care has a $20 copay, and inpatient hospital care is covered at 100%. The price of this plan, which includes prescription drugs, is $194.98 per member per month. The out-of-pocket maximum is $1,500. This means the most you would pay for your Medicare-covered medical services in a calendar year is $1,500. If your cost share reaches this amount, Aetna will cover your medical expenses at 100% for the rest of the calendar year. Let's now review a high-level summary of the prescription drug options included with your Aetna Medicare Advantage plan. Aetna has over 67,000 pharmacies in our network nationwide, but in order to have the lowest cost share, you will need to use one of Aetna's preferred pharmacies. We will talk more about that on the next slide. Aetna Rx Home Delivery allows you to get your 90-day supply maintenance medications mailed to your home at a lower cost share. Our online pharmacy and prescription tools include Check Our Drug List and Find a Pharmacy. Take some time to review the list of our preferred pharmacies. We want you to pay the lowest price possible for your prescription drugs. You'll save money on your copays when you use preferred pharmacies. If you wish to continue to use a pharmacy that is not on the list, you may do so, but you will pay a higher cost share. It's easy to find a preferred pharmacy near you. Members who get extra help are not required to fill prescriptions at preferred network pharmacies in order to get low-income subsidy, or LIS, copays. If you select the Premier Medical Plan, you will automatically be enrolled in the matching Premier Prescription Drug Plan. If you select the Standard Medical Plan, you will automatically be enrolled in the matching Standard Prescription Drug Plan. Both prescription drug plans have the same coverage and formulary, the list of medications covered by the plan. There is one difference. They have different deductibles. The Premier Plan has a $100 deductible, and the Standard Plan has a $200 deductible. Let's cover a few terms. Deductible. This is the amount you will pay up front for your prescription drugs before the plan starts paying. The Premier Plan has a $100 deductible, and the Standard Plan has a $200 deductible. Gap coverage. Both plans offer enhanced coverage and do not have a coverage gap, or donut hole. This means that in most instances, you will pay the same amount for your prescription drugs all year. Catastrophic coverage. Both plans have enhanced coverage. If you reach the catastrophic coverage phase, the plan will pay 100% of the cost of your prescription drugs for the rest of the calendar year. Non-Part D rider. Both plans have enhanced coverage and cover prescription drugs that are not covered by original Medicare. We will talk more about this on the next slide. If you buy your prescription drugs at your local pharmacy, you will pay the retail cost as shown in the grid. If you use mail order for your maintenance medications, you will pay less. Let's go over your cost share amounts for both the Premier and Standard Plan at a preferred pharmacy. For retail pharmacies, your cost share is shown in bold text for each drug tier and each plan if you use a preferred pharmacy. If you choose to use one of our other pharmacies that are not in the preferred network, you would pay the other cost shown, not in bold text, for each drug tier and each plan. Mail order costs from Aetna Rx Home Delivery are listed similarly. For mail order, your cost share is shown in bold text for each drug tier and each plan if you use a preferred pharmacy. If you choose to use one of our other pharmacies that are not in the preferred network, you would pay the other cost shown, not in bold text, for each drug tier and each plan. Specialty drugs are limited to a 30-day supply only, so they are not available through mail order. Both the Standard and Premier prescription drug plans cover Medicare Part D drugs that are not covered under original Medicare. And both plans also cover additional prescriptions including drugs used for anorexia, weight loss, or weight gain, prescription vitamins and mineral products, except prenatal vitamins and fluoride preparations, drugs used for the treatment of sexual or erectile dysfunction, or ED, drugs used for the symptomatic relief of cough and colds, drugs used to promote fertility, and drugs used for cosmetic purposes or hair growth. Let's review some Medicare prescription drug definitions. A formulary is the list of drugs that are covered under the Medicare Part D plan. Mail-order drug services, such as the Aetna RX home delivery, offer the convenience of home delivery with lower cost sharing. Quantity limits manage how much of a certain drug can be prescribed at one time. Pre-certification is when authorization is needed for certain drugs before they are covered by the plan. Step therapy is a review to see if you have tried other prescription drugs that work the same but may cost less. Previously, I mentioned the simplicity of the plan, such as having a single ID card and keeping your doctors, and we talked about the high-level plan design features. Now, I'd like to share with you some of the support programs you are going to get with the Aetna plan. All of the additional benefits I will review are offered to you at no additional cost and are included with both the Premier and Standard plans. At Aetna, we value your total health, physical, emotional, and social. We want to help you reach your full potential in life, however you define it. So we want to support you wherever you are on your health journey. If you are healthy and do not visit the doctor often, we can simply send reminders for upcoming preventive services you may want to consider. We also have a 24-hour nurse line that you can call to get advice anytime, even when your doctor's office is closed. Our fall prevention program is a way for us to help with your safety, whether you are prescribed a new medication which causes dizziness or perhaps you have osteoporosis. According to a 2016 study by the National Council on Aging, over 2.5 million emergency room visits per year are attributable to falls with the senior population. For those who want to help prevent health challenges from getting worse, we have programs to help with complex conditions such as diabetes and heart disease. For those who have complex medical conditions, we offer nurse case management, programs to help prevent you from being readmitted to the hospital, and compassionate care for advanced illnesses. We also offer our Resources for Living program, which provides community referrals for services you may be looking for, such as senior living options, recreation, community service and activities, emergency financial assistance programs, home contractors, and home cleaning, just to name a few. Although there is no additional cost for you to get information through the Resources for Living program, you will have to pay for the services if you choose to use them. All of these are included at no additional cost to you and are intended to complement your current healthcare. It isn't meant to replace it. Our Medicare Advantage plans include an annual Healthy Home Visit. This Healthy Home Visit is also completely voluntary. If you choose to take part, a nurse will come to your home to review your health needs and will do a home safety assessment. The visit does not replace care from your doctors, but we work with them to help meet your health needs. The nurse focuses on safety in your home, does a medication review, and asks about your medical and family history. We may recommend any of our previously mentioned support programs or others available through the Aetna Medicare Advantage plan that may be helpful for you. With your permission, we communicate the results of our visit with your primary care doctor. This way, your doctor can work with you to set up a course of action if necessary. This program is available at no extra cost to you and will help you take advantage of your benefits. Our voluntary diabetes program, which helps many retirees keep their diabetes under control, is also included in both your Medicare Advantage plan options. In this program, nurses will periodically call you. They make sure you are taking your medications correctly, keep track of your blood sugar levels, coach you on making healthy lifestyle choices, and answer any questions you may have. We also have dietitians who can give you advice about your special nutrition needs. At Aetna, our Medicare Advantage plans are designed to help you try to reach your health goals, whatever they are. Overall, those members currently enrolled in Aetna's Medicare Advantage plans are very happy with the plan. In fact, based on the annual survey we conduct on those currently enrolled in the Medicare Advantage plans, 96% of them have an overall satisfaction with our plan coverage and benefits. Now let's talk about how to enroll in the Aetna Medicare Advantage Premier or Standard plan if you decide one is right for you. We encourage you to give the Aetna plan a try. If you have any questions, do not hesitate to contact a member services representative at Aetna who is here to help. The number to call to speak to a representative is 1-800-307-4830. Let me give that number one more time. The number to call with questions is 1-800-307-4830. For eligibility or pension questions, or to enroll in one of the Aetna Medicare Advantage plans, call Doyle Rowe Limited at 1-866-201-2524. Again, the number for eligibility, pension questions, or enrollment is 1-866-201-2524. Thank you for your time.